Okay, so this was a patient who had a renal cell carcinoma. You can see it was pretty infiltrative, pretty extensive here. And it was involving the renal vein here. So if we narrow windows, we can see that it's invading the renal vein. And the patient had bilateral adrenal nodules. So these adrenal nodules were fairly nonspecific. So we looked at them on our in and out of phase. And we saw that the adrenal nodules were dropping on the out of phase compared to the in phase on both sides. So what do you guys think about these adrenal nodules?
Adenoma.
Adenoma, good. So that's what we're taught. Like, and actually there were a couple of adrenal nodules here, and they were all dropping out. So we kind of jumped to the conclusion that these were adenomas. But any other possibilities? We don't have a prior. Anu is asking me. Or sorry, Emma is asking if there's a prior. No, and Anu is asking about adrenal rests. You mean adrenal rests in the adrenal gland, or? Okay, well, any other possibilities? So far we have adenoma.
And I think we can have some of the RCC, some rare kind have like fat in them.
Exactly. So Lori was asking about AMLs. AMLs would be unusual for the adrenal gland themselves. That'd be more common for the kidney. I don't think I even have seen an AML in the adrenal itself. You can also get it in the liver. But Gitanjali and Rupa got it. So these are fat-containing renal metastases. So the key here is that renal cell carcinoma can have intravoxel fat in it. And you can see that this renal cell carcinoma is dropping on the out of phase, so it actually has intravoxel fat. And the adrenal lesions are looking just like the renal cell carcinoma. So you have to be very careful. If it has intravoxel fat, don't just jump to the conclusion that this is an adenoma. It could be RCC mets, and especially when you have an RCC right there that has intravoxel fat, be very, very careful. So this adrenal gland was resected with the kidney, and it had an adrenal metastasis, RCC metastasis in it. And then this one has been growing over time. So these were adrenal mets with intravoxel fat. Generally, though, RCCs don't have bulk fat unless they're encasing fat. So, for example, this is not bulk fat in here with the India ink. That's just renal sinus fat next to it. If it's really big, it can encase some fat, but it's really rare for an RCC to have bulk fat. Okay.